Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And I am joined today by Nancy Ceulemans. Nancy and I have known each other for probably 13 or 14 years now. We connected quite a few years ago because we both work with individuals on the autism spectrum. And I don't exactly remember how our paths crossed initially, but we went up striking up a conversation at one point about a treatment approach that she works with, has worked with for many years now. It's an approach called the HANDLE approach. HANDLE is an acronym for Holistic Approach to Neurodevelopment Learning Efficiency, if memory serves. Pretty sure that's what it stands for. It's a mouthful. And it's a really, really interesting method that involves using different assessments and exercises to help with sensory integration, nervous system development, learning efficiency optimization, a whole bunch of different things. So I did a couple of introductory courses in it just to learn more about it, and I was really fascinated by it. So I've referred patients to her over the years for handle work, and so we reconnected recently. And or we're touching base about a patient recently, and she mentioned she had written a book. The book is called From Awareness to Action, Empowering Early Childhood Educators to Support Children with Autism. So it was published back in September of 2024. So I wanted to talk to her about her book, talk to her about what's been going on with her practice, and thought, hey, let's have a chat on my podcast. And she was up for it. So I am going to pause the recording here, and I'll be joined again in just a moment with Nancy. All right, everyone. Well, I'm now joined by Nancy Ceulemans. Nancy, thanks so much for taking the time to chat with me today.
Thank you for having me, Brian.
Yeah, it's really nice that we get to reconnect. And I know we were just chatting a minute about all the many, many things you've been doing, all the globe trotting and teaching all over the place. So, if you don't mind just giving folks a bit of an introduction or a background on like who you are or what you do, and then we'll take it from there if that's okay.
Okay. So I'm originally from Belgium. Um, I have a degree in education. I first started with studying classical music, and I did that for 4 years and then changed to a teaching degree. Um, One of the reasons was because children are such forgiving listeners. You can do so much with music. They're always happy when you do that. So my degree in education, but I also traveled and lived and worked in different countries. So I worked in the UK, I worked in Switzerland for a long time, and now I've been here in Canada for 16 years. So the work that I do right now is I'm in clinical practice where I see individuals, and that's actually all ages, but mostly children that have learning challenges. Um, uh, quite a group is kids on the autism spectrum. So I do that in clinical practice. On the other side, I love to create workshops for early childhood educators. And those can be on different topics, all related to development and growth. Um, and so when I do that, I very often I send a survey around as to what topics would you like me to create a workshop for? What are you hungry for in your learning path? And autism is one that comes up all the time. So I do actually quite do a lot of work on autism. I am a expert training leader in DIR Floor Time, which is now considered an evidence-based support model for supporting individuals on the spectrum. And I'm also an instructor for the Handle Institute, which is also really, yeah, a support model that is great to use for individuals on the spectrum. Yeah, I'm thinking that's about it.
Okay. Okay, that's a lot. Just maybe to get a few acronyms out of the way, Nancy, would you mind just speaking to? I'd like you to please tell us what handle
Yeah,
is in a nutshell. I know
yeah,
it's complex. Like I have a hard time giving
yeah,
a concise definition, so I'd love to hear yours.
yeah,
And so if you wouldn't mind, explaining like what is handle, maybe tell us a little bit about that, and then I'll ask you more about the DIR floor time. But maybe we can start
yeah.
with handle if you don't mind, please.
Sure. So HANDLE, that acronym stands for Holistic Approach to Neurodevelopment and Learning Efficiency. So holistic meaning that we're really trying to see a person as a whole. So when we're trying to support somebody, we want to acknowledge that nutrition, together with your sensory systems, together with your family system, your school system, all those systems that we live in or that are parts of our lives, are all contributors to who we are, what we can do, sometimes what constricts us. And so it's that holistic thinking. And then the neurodevelopmental part that Handel is very, very strong in is really looking at how brains develop, and looking at all the little components that could make that neural network start to form a little different than it was going to be. So that's that neurodevelopmental component. And then they look at how does that relate to learning, and learning really seen in a very wide way, learning just as your overall personal growth. Yeah, so that's the Handle approach.
Okay.
Interesting though, the founder of the Handle approach, Judy Bluestone, she was on the spectrum herself. So that makes it super interesting in a sense that she can talk about autism like really somebody who knows how it feels,
Hmm.
right? And that makes the knowledge of the handle approach super, super interesting and super valuable for me. Really connecting the neuroscience to how it really feels.
Yeah, it's a really fascinating approach. I remember doing a couple of the workshops that you were, I can't remember if you were running them or you were, brought in a facilitator. I can't remember, as many
Yeah,
years ago now.
yeah.
Yeah, I remember it being really fascinating and very, very complex. Would you be able to just give listeners a little sense of, like, just an approximate sense of, let's say they, have a child on the autism spectrum, or they're an adult on the spectrum themselves, or maybe they're having issues with dyslexia or ADHD or something like that. And so they think, oh, I'd like to see if the handle approach, is a good fit for me. But just to give folks a sense of what is it like? They come to your office, and then what do you do with them? What kind of assessments? What does an assessment look like with the handle approach?
Yeah. So it's all, well, I usually start with saying, what are you really, really good at? Because most clients are coming here with a list of things that they want to change.
Mm-hmm.
They want to do better, or something, or a behavior that parents say, oh, can you please help me to stop this behavior?
Yes. Yeah.
So my first question is, let's see where the strengths are, because the strengths are really important to work with as a starting base.
Mm-hmm.
Um, and then we're going to look at like your whole history, like were you born with C-section or not? Like was mom when she was pregnant, was she bed rested or not? Because all those things can influence a little bit the systems that are growing in the womb
Mm-hmm.
during pregnancy. Um, and then we're going to look at the sensory systems, because the sensory and the motor systems are the systems that we use from the start that bring us information in.
Mm-hmm.
So if there's anything with those intake systems that's irregular, you're going to see that be connected and related to behaviors that we see. And that's not just for individuals on the spectrum, that is just for everybody. That's for somebody who comes here with diagnosis of ADHD. That is for somebody who has no diagnosis but just feels there's something that they want to grow more in.
Mm-hmm.
So yeah, so that sensory profile, and so that that will then relate to the assessment activities that we're doing. So the assessment activities are things, could be a few worksheets at a table, just to see like how are you decoding things, just to see, when I asked you draw a circle, for example, how are you doing that? Do you start tilting your head? Do you start moving more? Do you start sweating? Do your eyes start to water? Like all those things are really important clues to see which one of those systems might be in need of support.
Mm-hmm.
Yeah.
So, I mean, not to hopefully not putting you on the spot here, Nancy, but I'm just thinking of a child that I'm aware of right now, and like, he's, smart as a whip, incredibly intelligent, creative, gets, can figure things out. If say you asked him to, um, like make up a story about something, like he could talk for an hour, like dictating a story if you were typing it out for him. But if you ask him to write down the story, if he had to like write it out himself, even though he can spell all the words, knows how to make all the letters,
Yeah.
it would probably take an hour just to get that first sentence written out. It would be like pulling teeth to try to get him to write that out. So if you had a client that came in with that type of presentation, like what are some immediate things that I can see in your eyes there? You're thinking like already thinking like there might be this or this. So what kind of things would spring to
Yeah.
mind again, just to give sense a bit of like folks a bit of a sense of like, more of a specific example. What would you be thinking in a case like that, maybe?
So of course, I don't know his full profile,
Of
so we,
course, yeah.
we, we don't know what's going on inside of his body. Maybe he has nutrition difficulties and so on, and
Sure,
that's your specialty.
sure.
But I would be thinking, okay, his strength is that he can come up with all these stories. He
Mm,
can verbally say all those things.
mm,
So he has really great visual representations. He can connect them. Um, but when he writes, there's suddenly a problem. So I'm thinking there's a combination between just that cognitive work, um, executive functions, visual spatial work, visual imagery. He can do that. But as soon as there's writing involved, there's difficulty. So the connection between writing and that is that we suddenly need more motor systems to work,
mm,
right? The motor systems, meaning the eyes have to work. You have to sit up, which means your balancing system is working.
mm,
You now have to hold your pencil and position yourself in a very specific way. Your gross motor is busy with just being seated. Your fine motor is busy with writing. Your eyes have to combine the motor functions of the hand. So now you have a whole lot of sensory motor that needs to be functioning together with those higher cognitive areas of the brain.
mm,
And for some kids, that takes a little bit more time, or those connections are just more challenging, which means going back to motor functions. Because if you look developmentally, the motor functions, sensory systems, those neural networks are foundational normally for then growing further to making networks in the higher top brain.
mm,
So this kiddo has great capacity at the top, but when it needs to connect to motor,
mm,
the difficulties or the challenge is there. So I would strengthen that child would get an activity program, I call it,
mm,
which are playful activities. And usually they get like 6 to 8 activities, and each activity is not longer than 1 minute. So it's really short.
mm.
It needs to be playful, it needs to be fun, it needs to be short. And and those will then start strengthening those systems that need that support.
Um,
Yeah.
so could you give an example of what an activity like that might look like for, say, a child like this?
Yeah. And it will depend a little bit on the system. So we're going to try and detect like, is the visual system the one that is most challenged? Is
Mm,
the vestibular or inner ear system most challenged? Because the vestibular supports the eyes.
mhm,
Usually the vestibular is weaker, the eyes are weaker.
mhm,
Um, so, or maybe it's the hands, maybe it's the proprioceptive system, and the child doesn't really feel his fingers well to do the fine motor
mhm.
actions.
Yeah.
Um, so we're going to try and then go a little deeper in the assessments into all those systems.
Mhm,
So if I think, for example, for an activity that might support the visual functions, the eyes, very often when we start strengthening the muscles of the eyes,
mhm,
we usually already see a little bit of progress.
mm,
And one of the greatest things that nature has given us, and that goes all the way back to when babies are born, when babies are being fed and they're sucking, the eyes actually turn in each time when the baby sucks.
Mm,
It's like in and out and in and out. I usually joke a little bit about it, saying when we drink with the straw or when babies are sucking, it's like going to the gym with their eye muscles.
mm,
And
mhm,
so an activity could be every day drink 2 cups of water, but with a crazy straw, because the crazy straw is longer than a normal straw. It has a narrow diameter. Um, so you have to suck harder than
mhm,
than on a
mhm.
normal straw, which makes it a really good practice for the eyes to turn in and out and turn in and out.
Right.
So that is an example of an activity.
Okay. Cool. And I'm again reaching back here. It was many years ago now that I did those introductory courses, and I remember just learning enough to be like, this is really cool. I'm going to send patients to Nancy because I don't have the time to learn how to do this
Yeah.
myself. And so I seem to recall that there were, quite a few different assessment methods that were used, like quite a few tests that you can run. And as you said, you're taking the thorough history and all of that and figuring out like, where you kind of narrowing it down for this or that patient. So I'm just curious, again, for the sake of listeners here. So let's say, you know, a child comes in, you do an assessment, you identify there's something maybe with, on a visual, like on a eye muscle level, maybe on a tactile, like sensory level with their fingers. There's, figure out a few things that are going on. So you give them the exercises to work with. And then would they come back generally, a month later, 2 months later? When they come back, are you running the same sort of assessments again to look for these objective changes, or are you basing it more on, like, oh yeah, like he can write out his own stories now, no problem. Like, are you doing sort of objective reassessment tests, or is it based on outcomes? Like, how do you know you're making progress? How do you track your progress, and
Yeah.
how often are people coming back as a rule?
Yeah. I think it's a little bit of everything. I first of all I listen to what the child is telling me.
Mm,
I always address myself to the child first, um, and then ask the parent what they have been noticing.
mhm,
And then I usually, in a playful way, start doing parts of activities again, just to see how the child is doing that differently than the previous time that I saw them. So that could be for the eye one. We could sit together and play games like with finger puppets, just to see like can they follow the puppet longer
mm,
with their eyes
mhm,
compared to the previous session. Um, that could be feedback from mom saying, well, he used to go really, really fast when he read a picture book, but now he's got the ability to look for longer. He's really looking at the pictures.
mm,
So it could be those things. Could be lesser blinking of the eyes.
mhm,
Um, yeah, so there are little things that we can test. Um, also want to say that the handle approach is really an integrative way of working. So they know a little bit about the eyes, they know a little bit about vestibular, they know a little bit about digestion, a little bit about the gut, and
mm,
they really try to balance all that information and see how it hangs together.
mm,
However, that also means that when I feel that a client needs a professional who's more specialized in it,
mm,
then like for the internal things of the body, I might send them to you, Brian, because that's what you know so well, right? Or I might send them to a developmental optometrist and get some support from there as well.
mhm. Great.
Yeah.
Um, I won't stick on the handle topic for too much longer, Nancy. I just have a couple more quick
Hmm.
questions on that, and
Hmm.
we'll move on to something else because a lot I want to cover with you today.
Okay.
I've found in my own experience, like where I know we were email corresponding semi recently about like how we've been doing a lot of neurofeedback at the clinic, and there's other treatments that we work with that can have a, I guess if you will, like a rebalancing effect or regulating effect on the nervous system, which I'm what you're doing with the handle approach, and I'm sure other approaches that you use are doing that as well, remapping neural networks and all this good stuff. I know what I've seen, not in all patients, but in some, when they're doing work to help with nervous system, regulation and kind of balancing and integrating and whatnot. Sometimes there are, shall we say, you know, unexpected or unanticipated emotional releases that come up sometimes. I've had patients where they've, been coming in for their neurofeedback treatments. They're, sleeping better, their anxiety's getting better, their mood's getting better, their focus is getting better. I'll say, and then, the one day, like I don't know, I was gardening or I was, just reading my book, and then suddenly, like, I just had like this big cry. Like, I just cried for like, 10 minutes, not about anything in particular, but I just had this big emotional release. I don't know where it came from. And like, man, it felt good to get that out. But like, where did that come from? That's never happened to me before. And, it seems to be that sometimes, not everybody, but we can kind of see these like emotional releases, or maybe in a child where, they don't have as much self-awareness as adults. Not that
Mhm.
all adults have a lot of self-awareness, but hopefully most of us do. Then, maybe they're going to start acting out more, something like that. So I'm wondering, do you see any emotional releases or anything kind of like that when working with a handle approach with adults or with children?
I feel is very rare. I think in those 16 years, I may have had it twice.
Wow.
Um, and those were special in a sense that there had been abuse
Mhm.
in their, if you just look at their profile. And I think with the handle approach at that time, opening up all those systems also opened up feelings and memories that were shut off.
Mhm.
And so with those two particular cases, they would start suddenly with drawings about what had happened years earlier. So that came out in that way via drawings.
Mhm.
But most of the time, I would say always, the emotional regulation is growing, is becoming more stable. It's becoming kids become more comfortable as their systems start working better
Mhm.
throughout the program. It's going to contribute to regulation. And so you're going to see usually confidence grow, self-awareness grow. The idea that or yeah, their self-awareness. That's I'm trying to find another word to translate my Dutch Flemish thoughts into English here.
Mhm.
Um, yeah, so usually it really contributes to the self-regulatory part. And some of the activities that we're having are really working on just regulation, vagus nerve, a really important nerve in our ability to find our calm internally in so many ways.
Mhm.
Um, so yeah, um, the feelings that you described earlier, rarely,
Okay.
rarely, yeah,
Probably a selling feature, because those unexpected bursts of emotion are sometimes not what we
yeah,
want to have to encounter.
yeah,
So
yeah.
fair enough.
And we all have them, right? We all have those.
Indeed. Indeed. It
Yeah,
happens. Well, just before we move on from the handle topic, Nancy, would you be able to just share with folks, and I'll include this in the show notes, in the on the YouTube posting. I'll have this in the video description. But would you be able to share how folks can learn how to find a handle practitioner? Like, of course, if they're in Nova Scotia, you're in Nova Scotia as I am.
yeah,
But if say they're, well, I don't know, maybe do you do distance work with people with
yeah,
handle, or is it okay? So I
yeah,
guess if they, we'll put your contact information in there as well. But I believe there's a handle website as well, right? You can
yeah,
find practitioners. There's listings. So would you mind sharing that website, and
yeah.
I'll include it in the show
The
notes.
handle the handle website is just handle.org.
Oh man, that's an easy one.
Yeah,
Okay.
an easy one.
Okay. And
And I also have one, which is uniquelearning.ca. So you can find information on both of those websites
okay, great.
that approach. Yeah.
And I know with as naturopathic doctors, there's certain kind of rules and regulations about telemedicine, like out of country and stuff like that. We can work with folks out of country and out of province, but there's just certain regulations around that. So we have certain red tape, if you will, or hoops that we have to jump through. Is there anything like that with you, or can you work with anyone anywhere in the world? No problem. Okay, I
Yeah.
envy you that, Nancy. That's wonderful. Okay, that's great. Well, I'll include those links in the show notes, and that is wonderful. So I want to make sure that we have time to talk about the book that you wrote last year, or co-wrote last year, Nancy. But just before we jump into that, could we just quickly talk about the DIR Floor Time? Oh, there
Yeah.
we go. There's the book.
There's a book.
Sneak
There's
peek.
a book.
Yep. Um,
Um, and it has both. It has a lot of DIR in it as well. So
okay.
I can build on your question on
Okay.
DIR floor
Sure.
time.
Well, yeah, I mean, whatever way you want to work it. So if you want to talk about the book and work the DIR into that, or whatever you want to do, Nancy,
It's all in it.
we're flexible.
Yeah. Yeah. So the DIR floor time, again, an acronym, DIR stands for development. The I stands for individual differences. Everyone is unique, has different systems. Um, and then the R is about relationship. So it was an approach originally to support individuals on the spectrum. It's a play therapy approach. Um, but it has evolved so that it is now used. It's really used for all ages. It's also used for children who have irregularities in language development, for example, irregularities for social emotional development. So it can be used not just for kids on the autism spectrum, but also kids, for example, who at school might have regular meltdowns, could be supported by DIR floor time. Someone with selective mutism could be supported by DIR floor time as well as the handle approach. Um, yeah, so it's an approach that's a play therapy and right now has a lot of research behind them that it is now considered to be an evidence-based approach. It's not that much used here yet in Nova Scotia, but it is growing exponentially worldwide.
Mm,
Yeah. So I love that because it's a play therapy. It's really children just come here to play. And they really love it. And during play, of course, the adult is going to use all sorts of strategies to help that child shine, to make it feel confident, and to grow in their understanding of the world. And that you're going to see, although you're playing, you're going to see progress in so many things, in communicating, in being attentive, in learning to look for cues, facial expressions, um, expressive use of body language as well as words, receptive language, cognitive growth, social problem solving. So all that while playing is supported and is growing.
mm,
So that all that together, the work that I do with the handle approach in regards to autism, and then with DIR floor time in regards to autism, and just generally my work and the workshops that I created led basically to the creation of this book. Because time after time teaching the autism courses, time after time giving PDFs of what was said in the course, handing out the slides, made me think, why don't I write this all down in a book
mhm,
specifically for early childhood educators?
mhm,
And I think they play such an enormous, important role in supporting our children, and it's so underestimated. It's they are having those kiddos from very young, exactly during that time that those neural networks are forming.
mhm,
And they are forming and forming and forming until when kids are 6, until they can go to school. But the sensory and motor, that is all so much forming and maturing in those early childhood years. And those systems play such an important role in taking in information. And then the better we can take it in, the better we can do things with it, right?
mhm.
The brain can only do the best work depending on the information that it receives. So if it's coming in a stressful way, then it's gonna have to function with it and do things with it in a stressful way.
Hmm.
And so that's what the book is really about. It's a guidance for early childhood educators. Um, it has a lot of explanations about the behaviors, how it relates to what goes on inside the body, um, about sensory motor systems, but also about what might be happening in the gut, what might be happening with digestion, because you can sometimes give a person the best possible food, but if the body can't take the nutrients out of it to then do all the processes needed for us to think and function, then, even with the best possible food, something might not be optimally working well. And so that's what the book is about. Also, a lot of questions that early childhood educators sent to us. So, real questions from the real early childhood educators.
Hmm.
And then we also have a whole activity package. So, remember, I talked earlier about those sensory and motor systems? We've put an activity in for every system, one for vestibular, one for the vagus nerve, for calming,
Hmm.
one for the visual system, one for proprioception. So they have that as well, and it's all explained how you can do it individually with the child, or early childhood educators, they want to know how you can do that in a group setting because they might have to have 15 kids on their play carpet and
Hmm.
and they all have to be, part of the moment. So yeah, so that's what that book is about now. Coming back from all the proofreaders and the feedback that we got, people are saying, you should have chosen a different title because it's also for parents. And now people think it's only for early childhood educators.
Hmm.
So it is really, really good for parents who are just discovering irregularities with their child. And it's really hard to know where to go because you may get advice from others, um, but they're wondering, where do I go? Do I need to see a psychologist? Do I need to see Dr. Brian Rade? Do I need to see an occupational therapist? There's so many different fields that can all contribute to supporting, but where do you start?
Hmm.
And I think that is a question that parents often have, and I think the book is really helping with that.
Yeah, that's wonderful, Nancy. And yeah, as you were talking, I was thinking you kind of beat me to the punch there, but thinking like, like this would be good information for parents at large to have, not just for early childhood educators. And yeah, just even, of course, we play with our kids at home and like as parents. And so, why not also do these kinds of activities and exercises? One of the things I'm going to ask you about in more detail coming up here in just a moment is I've been doing screening for retained primitive reflexes in my
Yeah.
practice, and recommending exercises to help integrate those because that's been really helpful for a number of patients. Mostly pediatric patients, some adults as well, who have the maybe sort of a recurrence of those primitive reflexes. But like yeah, the treatment is really do these exercises with your kids, make it into a game, like make incorporate it into the play, and then that's what's going to help to integrate these. So yeah, that makes a lot of sense what you're saying. So are you going to when you have your second edition, are you going to rename the book?
Yeah, I'm currently writing another one then just for parents,
Oh, okay, okay.
really, really focusing on parents. What are they looking for? And not necessarily about autism, just like what if you start noticing irregularities and all the wonderings that parents have, is this going to be forever, or is this just going to be temporarily? Where do I go with this? Even yeah, the feelings that the parents have, sometimes parents even change their, I call it love language. Like they may be so empathic and so compassionate that they are that you can see in their bodies how stressed they are.
Mm.
And then the child is picking that up because that most trusting person, if that person is sending messages of stress about something the child is challenged with, then the child gets worried about the parents getting worried because they're noticing it, they're
Yeah.
feeling it, they're sensing it. So so yeah, the next book is going to be about parents and again about how all these systems in the body are all working together. You cannot isolate them when you want to support somebody with something. They all have their role in our function.
Yeah. Yeah, I think that's really, really important, Nancy, and I'm really glad you're writing the next book. Just in my practice, I'm not sure to what extent you get to see this in your line of work. Just maybe if you tend to have a younger demographic, but in my practice, I've had the opportunity to treat, the grandparent, their child, so, like the parent, the child, the grandparent, like transgenerational or multi-generational family members. And it just, I picked up on this in my first couple of years of practice, and it just never ceases to amaze me, like these transgenerational tendencies. It's like, oh yeah, like,
Yes.
my mom was really anxious, I'm really anxious, my daughter's really anxious about, these things. And, it's like, oh, I guess it's genes, ha ha ha. And it's like, well, yeah, there could be, we get into genomics and like, sure, there's differences in dopamine metabolism and this and that, other factors to consider. But at the same time, too, it's like, yeah, if, mom didn't, was holding stress around this or that, and then I'm holding stress around this or that, and then I'm with my child, I'm holding stress around this or that, like we're going to see these tendencies being passed down. And looking out for that, I think is, I'm really heartened by the what you're saying, some of the folks that I follow on social media. There's so much so many parenting advice accounts and things like that. Just kind of really looking at like, hey, like the way you act, like it really has an impact on our kids. And it's not just as simple as like, oh yeah, just don't abuse your child, give them enough food, provide the basic needs, and that's good enough. Like that's definitely a really important like foundational
Mhm.
starting point. But then over
Yeah.
and above that, our emotional regulation around our kids, like just so important. So I really couldn't agree more with what you're saying.
And I do a lot of work when I do floor time too. I try to make a profile of the parent as well. And in DIR floor time we call that the goodness of fit, reflecting on the goodness of fit. And it's not like, because when people hear goodness of fit, it's like, oh, we're going to try and find where I'm not good,
Mm,
where I'm not fitting. But that's not what it is about. It is, for example, I'm just thinking about a few kids that I now visually that are popping up. Um, let's say a dad is playing with his boy, a little boy, and there's a beautiful relationship and they're having fun, but the child is having difficulties with language development. Now, we want to look a little bit at what do we see in that communication in that play. For example, if the father is a very fast speaker, but the child has difficulties with processing, often parents don't even know, or they're not aware of that, or they are aware of that, but they're not doing anything with it. So the goodness of it is really there to think about, hey, let's think about myself as an adult. I'm a very fast speaker. So in that moment that I'm playing with my little boy, I'm gonna have to put extra attention to the fact that I should speak slower,
mm,
right? Or another example is, some parents are really good at teaching and demonstrating. And I'm thinking here about a child on the spectrum who is playing with the blocks, wooden blocks, in a very specific way, might be making lineups with it. And parents might go, hey, Johnny, look what we can do with the blocks. And they're building, right? Really demonstrating to Johnny that this is what daddy can do or mommy can do with the blocks. So, so that is more of a a leader in that profile of the adult. That adult is a leader, wants to have a teaching role and is demonstrating it, which is not a bad thing. But if that is your style, you might be doing that a lot,
mm,
right?
mhm,
And the more you do that, the more you're not accepting the idea that the child is just showing you. So if the child is making a lineup with the blocks or is tapping, making sounds with the blocks, that child has an idea. And we want to honor that idea in the first place, especially if they are on the spectrum, because the way they their ideas are formed and are presenting are often different than what typical children do. So you really want to first honor that idea. Oh, Johnny, you are tapping with the blocks and follow that idea. Oh, I've never done that before, but hey, this is cool, right?
Mhm.
And that's how you build that stronger attachment, a stronger joy, a stronger acknowledgement of that idea is going to lead to more confidence, is going to lead to the child feeling seen and appreciated and that they are worthy. And so instead of demonstrating this is what we eventually want you to do with the blocks making that tower, it's way more important not to do that too much, but to have the child show their ideas. And if you can change that strategy to following their lead, you're going to see that in the end you're going to grow way bigger um, than with demonstrating and just having the child copy the adult's ideas. So coming back to that profile, that goodness of it, it's like, what is the awareness of ourselves as adults? Who am I? Am I a fast speaker or a slow speaker? Am I usually demonstrating a lot? Am I taking a leading role or am I more a follower? And just generally in my relationship with my wife or with my friends, am I usually a follower or a leader?
Mhm.
All that, just having that awareness. Sometimes parents like to go over that because mostly in life we don't think about that. We have some awareness of ourselves, but to really support a child who needs support, having that awareness and in that moment, trying to do your best a little bit to accommodate better, be a little bit less of that leader or speak slower. Um, yeah, I think that's important. And I'm also thinking an example that often comes up is sports.
Mhm.
Children are doing sports, or my child, he's really not good at hockey, and I've tried basketball, and we've also tried tennis, and now he doesn't want to do sports anymore. And then if we look at the child's profile, for example, if a child has vestibular irregularities, so that is a lot to do with balance, but way more, also whether you're going fast or slow, or whether you're twirling or not.
Mhm.
If a child has a weaker vestibular system, is usually not going to like hockey
Mhm.
because it requires so much of your balance, right? But maybe in the family, everybody's a hockey player. So that's maybe why the parents guided their child and try to have that child that shared interest in hockey, but their body might not be ready for that.
Mhm.
Same with binocular irregularities, if it's hard for you when a ball comes towards you, then maybe tennis or basketball is not the best sport.
Mhm.
Um, yeah, so all those things, like when I work with my clients, we're considering all of those. Um, yeah,
It really is a holistic approach, Nancy, which is wonderful.
yeah.
Nancy, I have a bunch of other questions for you, but I know our time is winding down, so we might need to do a part two at some point. Maybe when your next book is published, we can chat
Okay.
again, if not sooner. But Just as we're kind of winding down here, we mentioned about handle.org, uniquelearning.ca, like your own personal website. If folks want to work with you, would you mind holding up your book again, just so that
Okay.
folks can
Yeah.
see the title? And bearing in mind, this is not just for early childhood educators. This is for anybody with parents or an interest in this topic. And stay tuned for the sequel that's more specifically geared to parents. And are there any other resources or links? Do you have social media accounts, like anything that you want to share, Nancy, with listeners if they want to? Yeah, anything you want to?
Yeah, I have my own website,
Mhm,
which is uniquelearning.ca.
mhm,
So my co-writer, I also had a co-writer. So she's a functional nutritionist and is also trained in Handle, is also trained in floor time and in other therapies.
mhm,
Um, so she also has social media.
mhm.
I think she's on Instagram now. I'm just quickly losing it's the gentle learning connection, the gentle learning connection. So we often post things together on there.
Mhm.
I have also a Facebook. Unique Learning has a Facebook page. Um,
Just typing this out here so I don't forget when I make in the show notes later. Okay. Great. Well, Nancy, thanks so much for taking the time to chat with me today. I really enjoyed our conversation. It was nice to get caught up and kind of have a sense of what you're doing. And yeah, just reminding me how awesome the handle approach is. I'm really interested in the DIR floor time as well. So I had not heard that term before. So thank you for teaching me, that new thing today. And yeah, I'm just really glad to have you in our community. And thanks for everything that you do with the folks that you work with.
Thank you for having me, Brian.
Well,
Thank
I hope
you.
that, yeah, you too. Thanks everyone who listened to this episode of the Overcoming Chronic Illness podcast. We hope you enjoyed it, and please stay tuned for the next one.